Money FM 89.3, the best of the afternoon update. The afternoon update with Lin Li Fu.
That's right, you're with me, Lin Li, on the Afternoon Update. Welcome to Good Tech, our brand new weekly segment where we take an inspiring look at innovative technology and ways it's used to drive impactful social change. Every Wednesday, we hope to bring you powerful and uplifting stories about technology and how it's creating a positive impact on society, addressing urgent social challenges and improving the quality of life for individuals and communities. Discover new ideas through initiatives and thought leadership where technology meets purpose for social good. Now, every year, millions of expectant mothers face preventable complications due to gaps in maternal health care. While medical advancements have made pregnancy safer than ever, accessibility remains a challenge, especially in regions where hospital visits aren't always convenient or feasible. But what if technology could bridge that gap? Singapore-based MedTech startup Biorithm is doing just that with their flagship platform Femom. They're harnessing remote monitoring and data science to provide more personalized and accessible maternity care. By empowering clinicians with real-time insights and giving mothers greater control over their health, Biorithm is redefining how maternal care is delivered. And joining us today is Amrish Nair, co-founder and chief technology officer of Biorithm. He's going to be sharing how his team is working to end preventable pregnancy complications in maternal health care. Welcome to the studio, Amrish.
Yeah, thanks, Lynn. Thanks for having me over.
Okay. Now, Amrish, tell me about Biorithm. Your mission is to end preventable poor outcomes in pregnancy. What inspired you to tackle this issue, and what gaps in maternal health care do you see?
So pregnancy in itself is not a disease. And, it's really about how do we get the best possible outcome in care. And what we're looking at is how do we enable that and enable a better patient experience through technology. And so it's really about how do we deliver that experience to each individual woman. And, coming from a family where, my wife had a couple of very difficult pregnancies. And, you're wondering, as an engineer, could we do something about this? So the company started off life as a research project with an NTU. Wow. We spun off doing cardiology, adult cardiology. And, we then took a deep, hard look one morning, right? When it's tough to get up in the morning, it's time to do something new. And so we took a deep, hard look and, where could this be used for social good? How can we help people who have largely been an underserved population and doing that social good with a technology problem, with a good business opportunity. And that's kind of what spun off the home monitoring platform, Femom.
I see. Yeah. And this platform, Femom, brings hospital-level maternity care to the home. Wow. How does it work? And what kind of impact have you seen so far?
So when moms go into the clinic to see the doctor, they traditionally get a scan, they get a fetal heart rate assessment. And what we are looking at doing is bringing that fetal heart rate assessment into the home. It's a very dynamic test which allows the doctor to see how well the baby is doing and also assess if there are contractions and other aspects of the care that they need to look into. So what we've done is we've developed a monitor. Okay. And it's picking up all these little signals, right, from the baby's heart, from the mother's heart, from the muscles, and basically separating that, then giving the relevant information to the doctor. So what we've done is created a wearable that does not need a nurse.
I see.
And that's the little trick. Every woman who's been in a labor ward would know that, this is belts and all these sort of clunky equipment that they use. And
I remember those, yes.
And, what we want to do is have a single placement device. Woman takes the device, sticks it over her navel, and she's able to monitor herself. And we do that by redesigning the technology, right? And so the secret sauce of the company is hearing all these things like the muscle noise, the baby's heartbeats. Yes. How do we separate them? It's like listening to a room which is loud music and 10 people talking. How do we know what's the music? How do you know what each individual is saying? And so this is really about listening to what the baby's heart is telling us and being able to isolate that accurately. And so that's kind of what we do. That's the secret sauce that we took from NTU, being able to separate all those things.
I'm curious now, because you mentioned that you're an engineer by trade. So you must know a little bit about science there,
So the project at NTU was largely with dealing with hospitals. So my co-founder is a cardiologist.
I see.
My other co-founder, Pina, is professor of engineering. But I largely grew up in a family full of doctors. I'm kind of the black sheep. Didn't study hard enough, the typical story. But I grew up around people delivering care, right? And I know how important it is to the patients and, how hard it is for the doctors and nurses as well. So it's really about how do we have technology that can not just improve patient satisfaction, but make healthcare delivery a lot easier. Yes. So that's kind of where it came from, It's that sort of background that I had.
So that's somewhere inside you, healthcare, but through technology.
Exactly, right. I got there somehow, right?
Okay, Biorithm recently secured a $3.5 million Series A funding. So how will this investment help expand your vision, especially in this region, Southeast Asia?
So, startups are always fundraising. We go into every room hand in hand. We are professional beggars by trade. So, we raised that money about a year and a half ago, and that really drove our product development and expansion. So medical device is regulated. So we have used that money to go through the regulatory activities, the clinical trials needed to prove safety. It's very important to us that we build something that's safe and that has sufficient performance for the doctors and for the patients as well. So going through all those testing, but also using the testing in each country, the FDA in the US, HSA in Singapore, delivering that later this year to doctors in Houston, Boston to begin with in the US. But we're very proud to be working with our, local public and private institutions.
Yeah, I was going to ask that. Care. So how is it connected to the local healthcare system?
Singapore's got a very unique healthcare system, I would say. A lot of women pay out of pocket, whether it's subsidized or fully private. There are a lot of women do pay out of pocket for care. And Singapore does have very low preventable outcome rates. But what we do have is the opportunity to sort of revolutionize maternity care by putting patient at the center of it. No longer the clinic and the hospital at the center of it, but the patient. And I think that's what women are clamoring for. I think after every presentation, you have women who come out and say, I wish I had this during my pregnancy, because not only would it have been logistically easier, but having that peace of mind is essential, that reassurance.
Of course.
And that's why I love doing what we do. It goes beyond just the clinical aspect of it, where, doctors analyze data and whatnot. It goes to the fact that we're providing the woman with reassurance. And this is increasingly important emotional aspect of care that has seen a big trend worldwide.
It's a very big part of being pregnant,
Absolutely.
Having the peace of mind, and it all goes into the well-being of the mother and the baby, Okay, so what markets are you looking at specifically in this region, in Southeast Asia?
So in Southeast Asia, we're starting off with Singapore. Singapore is a thought leader in the region, particularly when it comes to medical technology, latest procedures. We have a bunch of OBGYNs who have backed us as a company. And, we've worked with all our public institutions so far. And when we do get clearance later this year, we've already setting up pilots with all our major public institutions. So I think, if you've just found out you're pregnant, hopefully we could be of service to you later this year.
Wow.
And I think look out for good news and look out for the availability of the product in the second half of the year.
Very exciting. Now, women's health historically has been underserved in medical innovation. So, what's the thinking behind this? How does Biorithm challenge the status quo? And where do you see the future of femtech heading?
So, I think there are a couple of issues. One is it's been drastically underfunded. And evidence from women's health in particular needs to be a lot more longitudinal. We need to look at data from women's health as a continuum rather than isolated aspects. Right now you have cancer care, you have, postmenopausal care, you have pregnancy care, but people don't realize it's part of the evolution of a woman through time.
That's
and
right.
So what we need to see is the impact on a woman at any point in time has both a financial, social, and medical impact overall. So the big vision here is, using maternity as a lens for how your health is going to be like for the rest of your life. So pregnancy is like a 9-month stress test. You have a baby that's sucking oxygen and nutrients out of your body, and, it's going bigger and bigger and bigger. And, in any other medical field, this would be a problem, but in pregnancy, it's a good thing. And this puts stress on the mother's body. And that's why you see moms develop diabetes, high blood pressure,
That's right.
chronic conditions. And how do we use this information and then build a health model for the mom, both for preventative care, for allowing her to take better care of herself as well. And I think that's the big vision. And using this monitoring, we're able to do that because we collect a lot more detailed information about the mother from her heart health, and using JSON devices for blood pressure, glucose. And so putting it all together in one repository allows us to conduct that level of research that's needed. So Femom is the first release, but it's by no means the last. It's the start of what we believe to be a revolution in maternity care.
Okay, but are you looking outside of maternity care? Because Biorithm, I think it's got so much potential.
We definitely do. And so I think looking at cardiology in women, it's a hugely underserved area. Maternity itself is an underserved area, but women-specific diseases, I think very, very interesting for the fact that, we've not really taken big notice of them. And, a woman is not a small man, which is how it's been classified in a lot of clinical trials and data, right? Very complex, dynamic physiology and biology, very unique to a man. And I think through this, what we're also trying to promote is how women can be involved, or pregnant women can be involved in clinical trials. How can we monitor mom and baby so that we know they're safe during these clinical trials? So it's the involvement of women in their own care. I think that's one of the most fundamental aspects of this.
Okay, I want to delve a little bit into the technicalities. How does Biorithm leverage data insights, and at the same time, you ensure privacy as well?
So privacy is at the forefront of what we do, and I think it's at the center of the design of the entire system. So we're still very interconnected. We ensure that interconnectivity between the mother and the doctor. And that is the sacrosanct relationship that we protect. So data is privy to the doctor and the mom. What we use is anonymized data to then train models to understand population-based behavior. But at an individual level, it's always maintained as private data between the doctor and patient. And I think that's something that's critical to allow trust in the system.
And I would assume that it's secure as well?
Yeah, and so we built to multiple standards, right? And so I think, there's global medical device standards, there's global information security system standards, all these ISOs with many numbers behind them that, we maintain multiple ISO systems to ensure that we are performing at industry standard or better. And as part of medical device design, the FDA has also included cybersecurity as an essential part of design. So medical privacy data, PDPA, HIPAA, GDPR, all these are incorporated into the systems we build and the data we collect. So, yeah, I think it's essential that trust. I think earning the trust of your customer is essential. For a doctor, keeping the trust of your patient is essential as well. So we make sure that we design systems that allow for that.
Okay, I'm curious now, Amrish. How long did you guys take to get things ready before you shouted it out to the whole world?
It was a while. Thanks for asking it. It's making me go back in time. It's been about 8 to 9 years. And so medical device traditionally takes about 5 to 10 years to commercialize. So we're on the upper end of that scale.
Wow.
But, we started off in cardiology, like I said, for a year or two, and then we pivoted over into maternal health. We really, got some good momentum before COVID. And what COVID did was it really said to the whole world that, remote patient health or remote patient monitoring is here to stay. Before that, it was a very disparate field of medicine. It was used very sparingly, not in a consistent way. There were no protocols around it. So COVID really emphasized that. But what also happened during COVID was all research was shut down. So that delayed us for a period of time. And after that, it started picking up again. It started off with the UK in London, Singapore, US. And we could just see the explosion in interest, right? COVID was a tragedy, but it did in 2 years what 30 years of practice couldn't have done, which is really break that mold of remote data is good enough for patient care. So, yeah, I think it's been quite a journey. And, the staff and investors and collaborators, women, doctors have been incredible throughout.
Indeed, a labor of love. What's next for Biorithm? Are there any upcoming clinical trials or partnerships or innovations you're excited about?
Yeah, absolutely. And, we partner with, like I said, local and, US-based London, biggest contributor, our biggest collaborators in London. We partner with these hospitals because these are the doctors who are defining the next 10 years of OBGYN. And our clinical trials, just that you mentioned earlier about what else can we do, right, beyond. And these are the clinical trials that are producing data in multiple different indications, multiple different women with different types of conditions. And so we will be expanding our pilot program in the US. Boston's coming online this month.
Fantastic.
And in Singapore, fingers crossed, it could be in the second half of this year. And in Houston, they're doing some crazy things in Houston where it involves things like fetal surgery, saving babies in utero. And so we have a couple of really great doctors we work with in all these cities, in London, Boston, Houston, Singapore, which are adding new indications, but also building more evidence. It's a very new field, and we fully admit that. We need more evidence to show safety, to show performance, and it's a never-ending quest. Let's just put it that way, to collect that evidence, yeah.
But very, very exciting developments. Great stuff. Amrish Nair, co-founder and chief technology officer of Biorithm, sharing about how his team is working to end preventable pregnancy complications and revolutionizing maternal health care. Thank you so much, Amrish.
Thank you so much for having me.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.